So why is it that the professions are not doing anything? Maybe we haven't had the labeling of products, the products there that actually have been designed specifically for the use for children to limit that level of myopia. But we've seen over the last few years that there are lenses out there, contact lenses of both soft and rigid lens designs that will afford us some sort of protection over that level of increase in myopia. There has been the MySight lens really as a forerunner, which is a daily disposable soft contact lens, easy to use, that is getting levels of reduction in terms of the progression of myopia that are very meaningful, over 50%, 60, 70%, 80% are seen in some of these studies. So if we can really start to do something, we need to do it now. We need to do it in the very young age group because we know that that's when the treatments are most effective. But to do nothing in the wake of all the biomarkers that we're seeing today in terms of that extension of myopia and the elongation of the eye, I think this, if we're not doing anything, we're becoming complicit with a sight-threatening complication. We'll be seen retrospectively to really have missed an opportunity to save this next generation of potential myopes from sight-threatening complications. We owe it not only to our professions, but also to our individual patients to actually act now and act in a responsible way, an evidence-based way. Tell the story, inform patients, and at least do something today to protect this next generation of potential myopes from sight-threatening complications. It is a tsunami. It is one of the major healthcare issues in today's world. Today's world has changed in terms of the vision and ecology, that the ecological challenges of vision. By that I mean children are spending a large amount of times on electronic devices. Educational systems are putting a lot of pressure on children to do a lot of close-up reading, and this ecological change to the visual environment is actually impacting on the health of the eye. Okay. So if we do nothing, we know where this is going to go. It may be too late in some of these patients that we've had an opportunity over the last few years, the last 10 years, to actually impact on change. But at least for those that are upcoming myopes, those myopic patients that actually are there and that we can predict that myopic extension of the eye, we need to be doing something here, today, and over the forthcoming years. To do that, we need our professional bodies to start to change some of the regulatory systems, and more especially people like the Food and Drugs Administration, the FDA in the States, needs to start to consider this as a significant risk factor and start to recommend or at least endorse some lens designs, either specifically for myopia control, or at least say that myopic maculopathy and myopic eye disease can be limited by some of the products that we have existing in the market and those that we will see come to the market over the next decade or two. So this is just a call for action. If we do nothing, we will be here in another 5-10 years seeing that tsunami crash upon on the shores. We're seeing the little ripples. We're seeing those seismic changes in terms of the levels of myopia. We need to listen to these early markers and actually do something. So I call on everybody to at least think, consider options and what we can do in today's environment.